Okay, well, good evening, and thank you so much for joining again for yet another health session. So, my name is Dr. Williams, aka Queen, and I am here to try and help you to close that physician patient gap. So, I want to thank you for joining me, and I also want to take the time to apologize for Sunday. So on Sundays, I do a Bible review, making it make sense, where I try to break down the parables. And I was on this platform, and so it showed that I was doing a health session, which I was not. So I apologize for that. But do join me on Sunday for MIMS. But today we're going to talk about how we can break down and shorten that patient physician gap. We are going to jump into first, we want to talk about some of the medical disclaimer. As a physician, whenever I go into talking about health information, I must let you know that by viewing this live session, you acknowledge that the information is shared just with the intention for general informational purposes. Anything you do change or anything that I say that may apply to your health, you must discuss it with your healthcare provider. So I just want to take this time to leave this medical and health disclaimer up so that you may view it and you can pause, go back and view it at your leisure. Also want to take this time to ask you to share the link, and if you are on YouTube, to subscribe and ring that bell so you'll know when I go live. If you're on Facebook, to just be a member and to join and send off to other friends as we jump back into this. So last week we talked about some basic health information, and this week we're going to do the same thing. We're going to continue talking about that. So let's do a quick refresh on what it is that we discussed last week. So before we jump into anything complicated, I like to start with the basics, right? So last week, the basics that we talk about is, who are your healthcare providers? What's the difference between your primary care, PCM, PCP, physicians, MDs, DOs, etc.? So we went through and we defined all of that last week. If you missed it, you're in Facebook, it's still there. If you are on YouTube, you can also find that information there. So, just briefly, the professionals who you see for your primary care provider or your primary care manager, first you have the MDs and the DOs, which are medical doctor and the doctor of osteopath. And as you see here, really, it has to do with the amount and the length of training and their specialties. So for MD and DOs, they are in school for quite a while. After college, they do medical school for 4 years, and then they train in their specialty anywhere from 3 to 6 years. The nurse practitioners are typically have their doctorate, and they're able to see patients on their own in some states, depend on the state in which you live. And then there are also physician assistants. The big difference between nurse practitioner and physician assistants is that physician assistant must work under a medical doctor or a doctor of osteopathy. So it's good to know who it is you're seeing, if you're actually seeing a doctor or nurse or a physician assistant. But either way, these are professionals who do take care of you. We went into also discussing about that your body is very complicated, right? Very complicated. So if you take care of your vehicle, then taking care of your body requires even more. So you have to, when you go to your appointments, you have to prepare in advance. And you have to establish communication with your doctor. Be honest and open and ask any questions that you may have. That's what they are there for. They're there to answer the questions, to prioritize your questions that you want to ask. If there's something that is new, you want to be sure to write this down so you can ask your doctor the questions that are of importance to you. And don't forget, before you leave that office, you need to know what your follow up plan is. That is, if there are tests, what the tests are, what it is that they're looking for, and when you're supposed to come back, who you're supposed to call, etc. We then quickly jumped into the silent killers and just knowing your family genes and high blood pressure, diabetes, heart issues, kidney issues, cancer, etc. But we stop right there, right? Because before we could jump into talking about any diagnosis, we have to once again take a step back and look at, well, what are some of the basics that we need to know when we're talking to our primary care provider or any specialist on any sort of diagnosis? There are certain terminologies that are used consistently that you ought to know what they mean. And so before we get into diagnosis and talking about different things, I want to make sure that you have the basic understanding as to what some of these common terminologies mean. So let's jump right into that. So, again, please remember to share and to invite friends and family and those who you think that may benefit from this. So let's get into talking about doctorese, right? That's why some of our folks call it. It's like a whole different language. And just knowing the basics in the differences will help make that communication go better. So it's good to know the difference between signs versus symptoms, acute versus chronic, diagnosis versus prognosis, screening versus diagnostic test. If these things sound like they're the same or you don't know what these are, then you're in the right place. We're going to take a quick look at the differences between these. So when you go to meet with your primary care manager, you know how to describe what's going on and have better communication with them. So again, this is again like a new language. So we're just going to talk about what we call the doctorese. So let's jump into it here. So the first one we're going to look at is signs versus symptoms. What's the difference? They'll ask you what are the signs or the symptoms you're having. And many times folks are like, well, aren't they the same? No, they are not. So the definition of signs is something that's objective or evidence of a disease observed by a provider that they can measure or something that they can see. Symptoms are something that's more subjective, an experience report by the patient that cannot be measured or seen. So, therefore, when you go to the physician and they're asking you, what are the signs, or we're discussing signs, think about signs as like a stop sign, something that you can see, right? So a sign is something you can see or feel. So do you have fever? You can measure a fever with a thermometer. Do you have blisters or rash? You can see a blister or rash. Your blood pressure, if it's elevated, is something that they can take and they can measure your blood pressure to say whether or not your blood pressure is high. So these are things that can be seen, and these are considered to be signs. Okay. Symptoms, on the other hand, are things that your primary care providers they cannot see. They don't know. You have to tell them the symptoms you're experiencing. Examples are listed here. If you have a headache, that is only felt by you, the patient. If you are tired, that's felt by you. If you're nauseated, that's felt by you. If you have pain, that's felt by you. So the difference between signs and symptoms is that symptoms are things that you have to tell your provider, while signs are things that can be seen or measured. And this plays a big role when we come to talking about about cancer in the oncology setting. A lot of times I find when I'm talking to patients or trying to explain things, there's a lot of confusion between signs and symptoms and how do they know the difference. So this is a good insight in knowing the difference between signs is what you can see, like a stop sign, versus symptoms is something that you feel. No one can feel that for you. The other big issue in the doctories that we face is acute versus chronic. So, acute is the sudden onset of symptoms. And remember, symptoms is only what you can feel. So, if it's a sudden onset, then that is something you can feel. And if it's severe or it happens just within a short time period and is short lived, that is acute. So something like the common cold, experiencing a heart attack, appendicitis, an acute or a sudden abdominal pain, passing the kidney stones, those are all considered acute because it's sudden and it's happened in a short period of time. It's very short lived. On the other hand, chronic is something that's long lasting, a condition that's ongoing. It develops slowly, but then persists over time. So when we talk about something that is chronic, you're looking at a diagnosis of hypertension, diabetes, osteoarthritis, things that build up over time. These are not sudden. So when you present to your primary care manager or primary care provider, or if you're seeing a specialist, they will ask you, are your symptoms new or how long have these symptoms been going on? Um, the next thing we want to say, thank you so much. I see here, RD Love Me Better, good info. Thank you so much. Please remember to share with your friends and those on Facebook and other places as well. So, moving right along, knowing about acute versus chronic, these are common language that you will hear no matter what diagnosis you have or where you go to be seen. So, it's good to know these simple things. Otherwise, you'll feel like you're being turned around and twisted around by your provider. The next topic is diagnosis versus prognosis. This get mixed up all the time. It's Doc, what's the difference between diagnosis and prognosis? Aren't they the same? And I have to tell you, no, they are not. Right? So let's get into talking about the difference. Again, remember, I'm just breaking this down. As you see, I'm wearing my military hat and I'm a doctor. I've been in the military, both enlisted and as an officer, served, retired with over 20 years, worked in the cancer setting as well. And these are things that constantly come before me. So I thought I would make this information known just in general as well. So when you're talking about diagnosis, that is the identification of a disease or a condition. And that is based on what we have discussed before, right? Signs, symptoms, and any diagnostic tests that were taken. And we'll talk about that in a minute. The prognosis is when we are talking about the predicted course and outcome of a disease, right? What are the chances of recovery? Prognosis typically is used a lot in the cancer world as well. Like, doc, what's my prognosis? So let's take a look at some of these examples here. So, for diagnosis, if you've been diagnosed, you have a diagnosis of type 2 diabetes after you had a blood test. You may have been diagnosed with pneumonia after a chest x ray or a CAT scan shows something that's abnormal. You may have been diagnosed with heart attack because you present with symptoms of chest pain. And when they did blood tests or an EKG, it showed that you experienced damage to the heart. That's a diagnosis. You're now given an information regarding a disease status. Prognosis, on the other hand, is after you've been diagnosed, what is the outcome? What can you expect long term? So, examples given here is like prognosis if you've been diagnosed with early stage breast cancer. Is it a poor prognosis if you have advanced long stage lung cancer? And what about if you broke a bone, right? So, the prognosis is you'll be better in about 6 to 8 weeks. Pro meaning later. What can I expect later on? That's prognosis. And again, this are common terminologies used when you visit with your doctor. And so if you don't know these, everything will seem futile because the doctorese language versus what you know is like ships passing in the night. It won't make any sense to you. So it's very important for you to know some of the very common terminology. So let's see here. The next common terminology that we like to talk about is screening tests versus diagnostic tests. These, again, this is the kind of language we use a lot in the cancer world. And when I'm talking to my family and friends and others, these same questions, I should say, keep coming up because it's something that's common throughout and is heard on both sides of the fence, regardless if it's cancer or not. We cannot have conversations if you don't understand the basics of this language. So the next thing would be for screening test versus diagnostic test. A screening test is looking to see if there's anything wrong. So screening tests like mammogram for breast cancer screening, colonoscopy for colorectal cancer screening, blood pressure check for high blood pressure screening, all of these are very important. Now, I'll be talking more on the cancer tip later, but a lot of folks, I'm going to put a plug in right now that you need to have your colonoscopy done. If you're over the age of 45 and you are African American or of Black descent, you need to have your colonoscopy done. Same if you're of a 40, mammogram needs to be done. And we'll get into that much later on. The other thing now is diagnostic. Diagnostic is to confirm whether or not what was seen on a screening test is something to be concerned about. So if you had a abnormality that was seen on a mammogram, they would want tissue sample to see if this is cancer or not. An MRI is used to investigate, for example, if you have persistent headache. They will do an MRI to see if there's something wrong or if there's something going on in the brain. For diabetes, they'll look at blood glucose to test for suspicious diabetes. So those are diagnostic. These are tests that are in pursuit of making a diagnosis, be it for cancer or something else such as headache or diabetes or high blood pressure. These are all in the process of diagnosis. And I want to make a quick plug here. If you're ever told that you need to have an MRI done and you're claustrophobic, you need to make that known by your primary care manager or whichever specialist is recommending an MRI to be done. The MRI is like going into a dark, loud tunnel. So this can be very anxiety producing for folks who are claustrophobic. So that's just a quick insight for you. Okay, so next here, let's go on here. So that was just a quick overview. These are meant to be just within maybe 20 minutes, no more than 30 minutes, going over common questions that you have asked. Some of the other questions that I have pending from you, I have so many questions that are upcoming, but it would be a matter of futility to try to answer those questions if I don't first look at some of the common basic language that we speak. So for today's common doctorese, what I went over was understanding the differences between signs versus symptoms, acute versus chronic, diagnosis versus prognosis, and then also looking at screening test versus diagnostic test. And let's see, I think that is it. If there are any questions, please do let me know. So to look at some of the questions that you have asked in the past and what we have coming up, there's so much. Let's see here. Talking about when is a good time to move on from the doctor that you're currently seeing and unlocking some of the mysteries regarding your blood test, what's important, what's not. Then we'll get into early detection for cancer and myths and all of that. All of this information that's here are questions that you have asked. And every 2 weeks, I'll be going into this and looking at these questions. I did change the time from 6 p.m. to 7:30 p.m. so as not to conflict with some of the other things that are ongoing within the church, as well as folks who are working a little bit later would like to join. And so I made it a little bit later. Again, we'll be meeting every second and fourth Tuesday, 7:30 p.m. Central Standard Time. If you have any questions, now is a good time to ask as we come near the end here. I'll be wrapping up shortly. I hope this was educational for you and enlightening, and you have a better understanding of some of the doctories and terminologies that we use. You'll find that this would be helpful for any sort of doctor visits that you may have in the future. Two things right quick. So every Sunday, you can join me for plugging into looking at the Bible and certain things that in the metaphors and certain information that's got us stumped. And even as a physician, a lieutenant colonel retired, there are certain things in the Bible as a Christ follower that have me asking questions, and I like to make things simple and I want things to make sense. So I go into things, break it down, and just trying to understand. So join me every Sunday at 6 p.m. Central Standard Time, and here every second and fourth Tuesday where we go over the basics and learn about health as well. Until then, be blessed. Please do reach out. You can visit me at queenquanta.com and leave me your questions there. I want to thank you again for joining me. I see no questions, so it's been over 20 minutes, so my time here is up. But I do enjoy teaching and I do enjoy bringing this health information to you. So see you on Sunday or see you in 2 weeks. Until then, God bless. Take care. Thank you for joining. Bye.